Welcome to Health Focus, where we focus on your health. I'm your host, Dr. Scott Anderson. October is National Dental Hygiene Month, as designated by the American Dental Hygienists Association. Oral health is not just about gleaming smiles. Our dental health also reflects our physical well-being. For example, we now know that people with inflamed gums and dental infections may be prone to a variety of conditions, even heart attacks. The mechanism seems to be related to systemic inflammation, beginning in the mouth and eventually harming other organs. We also know that oral health may be reflective of systemic illness. As an example, people with medication side effects or poorly controlled diabetes may sometimes have a dry mouth and dry oral mucosa. This in turn can cause dental decay. It can also lead to difficulty with swallowing and other problems that are kind of embarrassing, like bad breath. So an oral checkup by your dentist with the assistance of a dental hygienist is really an investment in your health. Today we are very fortunate to have with us a guest from the American Dental Hygiene Association who will tell us more about dental hygiene. Please join me in welcoming our guest, Cathy Draper. Cathy is a practicing dental hygienist and a member of the Biological and Health Sciences faculty at Foothill College in Los Altos. Ms. Draper is also managing editor of a journal called the Dental Hygiene, the Journal of Dental Hygiene, and she holds a master's degree in dental hygiene from the University of Michigan. So it's really a treat to have you on Health Focus. We're really delighted you could make it in, Ms. Draper. So welcome, Cathy Draper, to our show. It's such a pleasure to have you here. I understand you began your career as a practicing dental hygienist and that you still do that, but somehow you wound up in teaching. Can you tell us a little bit about yourself?
Sure, Scott, and it's great to be with you here today to talk about Dental Hygiene Month. But as far as my career goes, I always wanted to be a teacher. And then because I liked science, I was encouraged by a dentist friend to look into dental hygiene, because dental hygienists are teachers as well as clinicians. So I've been practicing for over 40 years, and I got into teaching about 10, 12 years ago, teaching in a dental hygiene program with dental hygiene students. And then now my role as a teacher has evolved. So I teach a course to people who are interested in careers in healthcare. So it's been really a wonderful opportunity to work with people that want to go into healthcare. And I'm also working with high school students that want a career in healthcare. So teaching topics on health and wellness as well as oral health. So I've really got the best of all worlds with my clinical career and then also my editing role with the Journal of Dental Hygiene. So I get to use my writing skills and keep up to date on all the latest research in dental hygiene.
And I believe the American Dental Hygienists Association, in fact, is responsible for this month, and it's really the organization that has put together this awareness month.
Definitely. National Dental Hygiene Month actually began as a week-long observance of dental hygienists way back in the 1980s. And it grew from a week to a month, and then in the last 8 years, we've been partnering with Wrigley Oral Healthcare to promote National Dental Hygiene Month with some conversation starters with the public.
That's great. And with respect to National Dental Hygiene Month, I understand that really this is an awareness month that revolves around education. And I understand, Cathy, that there are actually 4 specific goals. Is that correct?
That's correct. We have brush, floss, rinse, and chew as the goals of this, the conversation starters this month with National Dental Hygiene Month. And they're really easy ways to get the conversation going with the patients and the public about practices that are easy to do and can improve your overall oral and total health. So it's really a great program honoring dental hygienists and the role we play in educating the public.
Yeah, I think prevention is really where it's at. Anything we can do to help people stay healthy is great. So let's start with brushing. You know, you must have seen people who know how to brush well, people who don't brush quite as well. What can you advise our viewers about brushing techniques and this twice-a-day goal?
Definitely. Well, twice a day is the goal, and you always want to look at your technique as well as the equipment, so to speak, that you use to brush your teeth with. I know when I look in the pharmacy or in the oral health department in any sort of retail outlet that there's a whole array of products, and for the consumer this is really confusing. But I always recommend that you use a soft bristle toothbrush that has a relatively small brush head so that you're able to better access the areas in the mouth that you need to clean. So as a dental hygienist, I look at myself as being a coach for my patients. So looking at what their particular oral health looks like, looking at the equipment that they're currently using, and then advising them on the best approaches to maintain optimal oral health.
Do you recommend for or against electric toothbrushes, or do you have a position on that?
Well, electric or power brushes, as we like to call them, they come in all different varieties. They can be battery, they can be rechargeable electric brushes. They can vibrate like this, or they can oscillate like that. There are so many different products on the market that I like to tell my patients it's sort of like having a Mac or a PC. They're both computers, and I can teach you how to use whatever product you have. So they can be a great adjunct because, of course, they're going to move much quicker than you can do by hand. And for a variety of patient needs, they can be really the lifesaver for their oral health practices with a brush. So it's more, you know, what kind of a product are you interested in, and looking at your overall dental anatomy, we kind of look at that and then make some recommendations based on their needs.
I noticed that on your website you have some audiovisual guides, and one of the things you mentioned is this 45-degree angle for brushing. So can you explain more or less what that's about?
What's the deal with 45 degrees? Okay, well, what I do with my patients is I always have a little cross-section chart so that they can see how the tooth sits in the jaw and where the ligaments are and where the top of the gum is. So if you have a little bit of an idea of the overall anatomy, then you'll understand why it's so important to use 45 degrees to slip in between the tooth and the gum so that you can really get at the bacterial biofilm or plaque where it's growing. So 45 degrees enables you to slip down in between the tooth and the gum and actually attack the plaque.
So if this is an upper tooth, this would be straight on. This would be coming up from below. 45 degrees is sort of at an angle.
Yeah, it's at an angle
like
so that you can slide up in between the tooth and the gum. So once you kind of understand what the overall anatomy is, then it makes how to place the toothbrush so much easier.
And Cathy, how long should a person brush for?
Well, the recommendation is about 2 minutes. Now, that's based on the fact that the average person brushes for less than a minute. So the idea is that if you can do 2 minutes, that you have been working to disrupt that plaque biofilm throughout the mouth, that you have a much better chance of being effective. Now, that said, you can brush longer than 2 minutes.
Right. And how often should we replace our toothbrushes?
Oh, that's a good question. You want to look at your brush. The basic rule of thumb is about every 3 to 4 months or once a season. But if you're using a soft bristle brush, often those bristles will start to bend and splay. And if you think of that 45-degree rule, if you've got kind of a curved brush, it's not going to fit into that space between the tooth and the gum. So you might need to replace more frequently.
Okay. And before we move on to the next goal, how about toothpaste versus tooth gel? With fluoride, without,
oh, yeah.
For sensitive teeth, without. Do you have any particular general thoughts on that?
Definitely. I mean, if you look at all the different toothpastes that are in the, your retail outlet, you have so many different products to choose from. And I like to tell my patients to think of toothpaste as being like vitamins for your teeth, okay? It's important to remember that the toothpaste alone does not remove the biofilm. That's the mechanical action of your brush and whatever you're using to clean in between the teeth. However, toothpaste brings fluoride to the tooth surface. It can also bring an antimicrobial to the tooth surface, or a desensitizing agent, and then again, whitening agents. So you need to look at what your overall goal is. We always recommend a fluoridated toothpaste because you always want to be replacing the fluoride that's being leached out of your tooth structure, or the calcium that's being leached out of the tooth structure, and then whatever else you need to look at.
Yeah.
So consulting with your dental hygienist and your dentist on which product line you should look at is really what I would recommend.
It's interesting that fluoride was such a subject of debate 50, 75 years ago when people were afraid to have water be fluoridated, but we now know it makes such a difference in improving your dental health, so that's really a wonderful thing. I'd like to move on to the second goal for this awareness month, and that's proper flossing. Maybe you can tell us a little bit about what the goal is and a little bit more detail about whether people are best served by using waxed floss, unwaxed floss, dental tape, and so forth. So first tell us about the goal.
Sure. The goal is interdental cleaning, and we choose the word floss because that's the most common thing that people think of. But you can think of it a little bit broader as cleaning in between your teeth. And if you think of the tooth as a four-sided figure, you have your inside and your outside that you can access really well with your brush. But what about in between? And if you look at yourself in the mirror and you look at your lower front teeth, the space in between is really thin. But if you look at the back teeth, it's pretty broad. So you need to have something, either floss or little interdental brushes, or you can use a water flosser to clean that area in between the teeth.
And you want to have an adequate amount of dental floss, right?
Definitely. If you are choosing floss as your product, you want to have about 18 inches of floss. And then the key thing to remember is that you need to slide that floss down in between the tooth and the gum, because that's the area that you are going to de-plaque. So in between the tooth and the gum, and then move it up and down several times to really scrape off that biofilm and also remove any food debris that's stuck in between the teeth.
Now, Cathy, does it matter if you floss before you brush or after you brush?
That's a good question. That's something people always worry about. Shall I floss afterwards? And I like to tell my patients that it doesn't matter if it's before or after, because if you're actually thinking about de-plaquing or removing that bacterial plaque from the entire tooth surface, does it really matter if it's before or after you brush? And from a psychological standpoint, after you've spent 2 minutes time brushing your teeth, sometimes you're kind of done with this. So I like to tailor my interdental cleaning instructions based on the patient's needs.
Right. It's an investment in your health. And
definitely.
I remember reading somewhere that you don't have to brush all of your teeth, just the ones you want to keep.
Just the ones you want to keep.
Right,
Yeah.
So that's right.
Exactly.
And the third goal I understand of this Health Awareness Month for dental hygiene has to do with using mouthwash. And that's very interesting because we think of mouthwash as being something just to make your breath a little bit nicer, but it's a part of comprehensive oral health, I understand.
Definitely, definitely. Mouthwashes actually fall into two different categories. One would be cosmetic, and the other would be therapeutic. So I'm going to talk to you about the therapeutic benefits of a mouth rinse. And we're recommending looking at rinsing and gargling with a therapeutic mouth rinse twice a day for about 30 seconds. Now, when you look at what's therapeutic, fluoride mouth rinses are very therapeutic because, again, you're putting fluoride back into the tooth structure. Mouth rinses that are called antimicrobials are also very important because if you think of all the structures in the mouth, the teeth only comprise about 20% of the oral cavity. Then you have your cheeks, your tongue, under the tongue, the back of the throat. All of those areas have bacteria. So you can reduce the overall bacterial load in the mouth by rinsing with an antimicrobial mouth rinse. Now, some of these mouth rinses are available over the counter. Many of them are. So you look at mouth rinses that have essential oils or another compound called cetylpyridium chloride, which is a real tongue twister, or mouth rinses that have peroxide components. Then the second type of therapeutic mouth rinse would be one that would be a prescription that you would get from your dentist, and that would be a mouth rinse with chlorhexidine. Now, the important thing to remember about mouth rinses is that you want to follow the directions. So either following the directions of your oral health care provider, rinse twice a day, 30 seconds, or following the directions on the package if it's a prescription product as well. And again, going back to your dentist or hygienist if you have any questions.
Yeah, it's amazing the difference in these mouthwashes without discussing any specific brands. Some of them have a very harsh menthol flavor, and some are even touted as being more efficacious because they're kind of harsh. Others are so sweet they're almost like a soft drink, although it's artificial.
Definitely.
So I guess the key thing is to use something with fluoride. Is that what I'm understanding?
Well, fluoride, if that's your main goal. If your other goal is an antimicrobial, then finding the antimicrobial product that you're best able to tolerate. And again, going back to your dental hygienist or your dentist with any questions.
You know, I keep thinking that everything you've taught us so far involves really preventive medicine because the mouth is part of the body and it's part of our overall preventive health. And it's all about getting into a routine that you're comfortable with, isn't it?
Definitely, definitely.
And it's about education, which I believe really starts at the earliest years.
Definitely. We want to start, education and oral health starting, with infancy and with teaching moms to brush the first baby tooth as it appears in the mouth, and also to get their infant to their oral health care provider within the first 12 months of life, and establishing a dental home. Education is key.
All right, I totally agree. And I'd like to turn to the fourth goal. And of course, we're talking about National Dental Hygiene Month and the 4 goals that have been promulgated to sort of encourage people to do a better job with their oral health. And the 4th one really caught my eye because, as I was saying to you off air, when I was a kid, teachers would always say, I don't want you coming to school with gum.
Definitely.
No gum. And, gum is something we associate with perhaps being impolite and so forth. And yet, it has such a therapeutic benefit in some situations. And the 4th goal, I believe, for this month, from the American Dental Hygienists Association, is to consider using a sugar-free chewing gum for 20 minutes after meals. So that really caught my eye. Maybe you could tell us a little bit more about that, Cathy.
Definitely. Yes, you are absolutely right that when I was in school, you would be sent to detention if you were chewing gum. And your school may still have rules about chewing gum. But to look at chewing gum having a therapeutic benefit is a whole different way to consider it because many gums, especially you want to make sure that your gum is sugar-free and then look at the other components in the gum. But by chewing gum for 20 minutes after eating, if you're not able to brush your teeth, can help remove the debris that's caught in between your teeth, stimulate salivary flow, neutralize the pH, add xylitol, which is a artificial sweetener that has antimicrobial effects. It can be really very beneficial. That said, you want to be sure that you're not chewing gum for extended periods of time. First of all, it's probably not appropriate in all workplace settings. And secondly, if you do have TMJ, temporal mandibular joint issues, chewing gum for hours at a time is probably not going to help your condition. So,
yeah, I guess if you really want to worry about every possible risk, if you're doing sports activities and chewing gum, you could also aspirate that and choke. So there's a time and a place for everything. But
definitely.
Let's face it, sometimes you might be on an airplane or something and you don't have access to water or your toothbrush, and if you could neutralize that pH and stimulate some saliva flow, it's better than nothing.
Definitely, Scott. And in fact, I had my Starbucks on my way in here to the studio, so I was able to follow up with a quick chewing gum therapy so that I had fresh breath and also increased my salivary flow.
Right. Well, we've covered all of the major goals. The first one, I believe, was brushing. The second one was flossing. The third was an oral mouthwash rinse. And the fourth is considered sugarless gum.
Yeah.
Now, I know that our viewers may have some additional questions, and they might wonder if they might have some of these questions addressed. Obviously, going to their dentist would be critical. I want to emphasize that there's no substitute for seeing your licensed dentist for a detailed workup and complete treatment. But clearly, the American Dental Hygienists Association is playing a role in educating the public on this critical issue. Where could the public go to get more information on this?
Well, definitely. We have on our website adha.org/daily4 is where all the resources are for National Dental Hygiene Month, but actually, consulting your dental hygienist and starting that conversation. You can say something, I saw brush, floss, rinse, and chew. Can you tell me more about that? The whole idea of the campaign is to have a conversation going because your hygienist is your total health, preventative health provider, and we see you more often than you see your physician sometimes.
Right. So, if you can't confide in your dental hygienist, who is there to talk to,
Who
right?
is there to talk to? Exactly.
That's fantastic. And do you have any activities planned to get the word out on this campaign?
Well, definitely. Hygienists across the country, members of the American Dental Hygienists Association, have all received posters promoting the Daily 4 and stickers to have in their practice or to put on their car window, just to get that conversation going. And many hygienists are out working in the community doing outreach activities to either educate or provide oral health screenings this month. It's a month that we really get out and do a lot of activities in the community.
So it's really important, and we're also talking about a team approach. So do you have any quick advice in our closing moments about how, for example, a person might choose a dentist or a dental hygienist? Obviously, where you live is a big part of it.
Definitely, definitely. In fact, looking at how to advise the general public on this question, I looked, because dental hygienists in most cases work together with a dentist. We're all part of your oral health care team. I went to the American Dental Association website, and they have a very handy search engine where you can put in your zip code, and then they will match you with all the member dentists in your area. That way, you can go on and look at their individual websites to see if this might be a match for you. You can also look at their staff and a lot of information that's open to the public.
Cathy, Draper, it's been really a privilege having you on Health Focus. It's really been just a really informative hour. Thank you so much for joining us.
Oh, thank you so much, Scott. It's been my pleasure.
Well, you know, I'd like to say in closing that dental hygiene may not be a subject that gets much attention, but everybody likes to have a nice smile and fresh breath. This has been an informative half hour, and I think we've at least begun to scratch the surface in terms of what's important about the American Dental Hygienists Association Awareness Month devoted to National Dental Hygiene. So in closing, I'd just like to thank all of our guests for joining us, and also to thank our audience members for participating in this informative half hour. Remember, on Health Focus, we always focus on your health. So until next time, thank you so much for joining us, and have a healthy rest of the year from all of us here at Health Focus. Thank you.